Medical professionals who work with sick individuals have always been at risk for infectious disease, but that risk has gone up exponentially amid the coronavirus pandemic, creating an overall feeling that such jobs have become much more dangerous. With this virus coming in, and its focus on elders, we're ground zero, says Kimberly Green, Chief Operating Officer at Diakonos Group, an Edmond, Oklahoma-based long-term care provider. For our staff, it changes everything. The company has spent $700,000 on new personal protective equipment for its 200 employees, instituted new rules about who can enter the buildings, and invested in a negative air pressure system and UV light cleaning robots for its COVID unit. Even with such measures, more than 40 staff and clients contracted the virus. So Green wasn't surprised at all to hear that healthcare workers took the top 2 spots on study looking at U.S. workers most at risk for infection or disease. The study, released in April and conducted by Marissa Baker, an assistant professor in the University of Washington School of Public Health, found that 10% of workers in the United States face exposure to infection at least once a week, and nearly 4% face such exposure at least once a month. That number includes farm workers, but does not include self-employed workers, household employees, or freelance workers. Those numbers are likely far lower than the actual figures, since they doesn't include gig workers, such as food delivery workers or rideshare drivers who are also at higher risk. Also, the study relied on a survey conducted before the novel coronavirus began to spread, and many workers, such as those in meatpacking plants or grocery stores, may not have been aware of the extent their actual exposure to infectious diseases. We now have a lot more public consciousness and knowledge about what constitutes an exposure to an infectious disease, which is any time that you interact with another person, Baker says. While some frontline workers like police officers and firefighters have always known that their job carries inherent risk, it may be an adjustment for others, says Robert Hughes, an assistant professor in the Legal Studies and Business Ethics Department of the Wharton School at the University of Pennsylvania. When people go into nursing, unless they're going into specific kinds, they're not thinking that it's a physically dangerous job, he says. They know that infectious disease exists, but the degree to which it is dangerous has changed. As the country reopens and more companies start bringing employees back on site, they're looking for ways to mitigate those risks, from closing down break rooms where people congregate to requiring hand washing at regular intervals.